Let's talk about this. I don't know. A lot of people deal with drug addiction every day. Some people they don't even realize they're addicted to drugs.
I think it's way more. Well, I can't say way more, but it's a pretty common thing. Like
Yes,
really
it is.
common.
Since I'm the head moderator, I answer the question. I 100% think it's a disease. It may start it out as a choice, but that choice is no longer theirs. After being addicted to it for so long and doing something for so long, I don't think that choice is there. I mean, it's always there, but
What
they
about like addictive bloodlines?
that I believe in. Mhm.
Like if you come from like if you come
Somebody
from a
mute me.
line of like
Mute me, please. I'm sorry, Z. Mute me. I can't. My phone froze, so he can talk. Somebody mute me.
I don't know how
It
to do
won't let
that.
me mute you.
Fucking app is
Yeah, I was gonna
ridiculous.
say I
Go
can't.
ahead, Z. I'm gonna be
No, I
quiet.
don't. Hey
Hi,
guys.
Makita.
Welcome, Nikita.
I mean, it comes down to like bloodlines,
I got it.
neurological, will, power. It's like a combination of elements. I don't even know. I mean, we got the perception of choice, and I think that's comforting enough to us. And as long as we don't have something that entices something that might be sensitive to us neurologically or from a time that we didn't exist in that can extend to us, we're just a hallway full of light switches, one switch flip away from becoming a statistic, trying to be bigger than, a whole historical alignment of things that have pretty much embedded themselves into our bloodline. So the choice part, I think it's only as like far as what it is you do, and then for like you just forget that you're addicted. Like you just turn around and be like, hold on, I just did this, but now I'm doing this, and it took somebody else outside of me to even realize that this was what was happening. But it's like where do you tackle the shit at first when it comes down to that? Do you tackle the shit neurologically from your own self because you can make your choices? Do you tackle it at a bloodline before your existence, not knowing the sensitivity of what could be addictive to you? Where does the choice actually begin at?
I would say that I agree with most of what you said. However, I don't agree that bloodlines necessarily um, makes a person become an addict. And I'm going to use myself as an example. On my dad's side of the family, 99% of them are all addicts. I myself, I'm not an addict. Now, I made the choice to not because of seeing what that did. So I don't necessarily think that our bloodlines would make us become addicted to something, but they could influence our choices on whether or not we choose to become addicted.
Yeah, that's what I
I
was
agree.
gonna say. Is
I agree with that.
generational drug use does come into play because um, I have seen personally people that I know that are very close to me do it, and um, it kind of made me think like, what's so great about that that's being chosen over me, kind of thing. Um, which then made my mind want to wander and explore like what's so good about it that that's being chosen.
Like I hate that I smoke cigarettes, and I started smoking cigarettes. When it comes down to statistically, I smoked way too late for somebody that should be smoking the way I'm smoking. But every time I've like weaned myself off of it, you start to realize with any type of vice, any type of addiction, it starts to become like within like the confines of what is considered an addiction and man-made rules, what is considered addiction and God-made rules. And I just know that when you get to like a certain point, if you have a certain type of vice, going like 3 days or a week without it, rather it be cigarettes, fucking heroin, crack, whatever it is, if chemically you feel off, then you start to realize that if you can make it on the other side of that rift that you begin to feel when being apart from something, a whole bunch of power starts to like flow through you. The problem with it is it's almost forgotten from like your childhood self when you weren't really doing none of these types of things. So then the anxiety and the older you get starts to become like this anticipational buildup on if you're even capable to like go without doing something that has became a comfort. So then it becomes like, where does the level of the vice become critical? Is it at the laws angle? Is it at that particular drug angle? Is it what is approved as being legal or illegal? Is it what is killing you? Because we could go down from drugs to cigarettes to alcohol, and in some shape, form, or fashion, it's doing all of this shit. So then it starts to be a process of picking your poison. And then from there, asking yourself, does the specifics of what you are doing or not doing still generalize the same foundation of how we shouldn't just be addicted to anything but the concept of life, opposed to the vices that come with it, and then determining the choices of how much it's going to affect us. And unfortunately, there seems to be a reality with fast food, whatever. I could eat McDonald's for 10 years right now, but then 20 years later, the shit I did within this 10-year period affects me, knocking 10 years off of my life. I don't really know where the addiction and the choice of it begins in a world where there's so many perceptions of free will. Oh, I land. I'm sorry.
Salute to the room. Salute to the room. What's good, y'all?
Welcome to the room, Florida. Welcome. Everybody, welcome to the room. Straight no chaser, everybody in the audience. Thank you for being here. It's pretty simple in our room. It's popcorn style. We respect everybody's opinion, no matter what it is. All we ask is to show respect to one another. The topic is drug addiction, a choice or a disease. This is a very serious topic, um, a sensitive topic, because I know there's some people that look at it, the disease way, and others that look at it as it's a choice. So we like to hear everybody's input, but still be respectful to everybody's opinion. So if anybody want to jump in, I'm gonna land right there.
Well, it's my understanding that it was already expressed, but still, I believe that it is a choice that ultimately becomes a disease because you end up not being able to control the actual choice anymore. So it stops becoming your doing, and now physiologically, emotionally, mentally, you have become dependent on it to where it is now a parasite for you. So it's a disease.
Absolutely. And I think another thing as well, and I'm not somebody who's very well versed in drug addiction, but I do know that some people it's like a physical addiction, and for some it's more of like a mental or psychological addiction. So I think there's definitely differences in how a person is addicted and how they can get out of that addiction.
It is definitely physical and mental, because when you are addicted, there comes the withdrawals when you're not using, when and then mentally, your brain, there's receptors in your brain, and those get affected when you use drugs, which is why you have the cravings and the withdrawals and stuff, because it's telling your body that you need that to continue going about with your day or whatever.
I agree with everything y'all saying from personal experience. Yeah, y'all making a lot of sense.
Yes, this is all coming from personal experience as well.
I'm gonna go as far as say I feel like it be at least for I'm gonna speak from my case. I be feeling like it's more so of a mental thing than the physical. Um, because like I'm gonna use this for example, smoking cigarettes. Some people like start smoking cigarettes because they see other people at work doing it. You get what I'm saying? They go take that 15. They might start out with a black. They might hit it one or two times. The next thing you know, a single. Hey, let me get a cigarette here. Let me get a cigarette there. Next thing you know, they the ones that's giving you the packs. You get what I'm saying? The smoke. Um, and it be something to do like for that time being. Uh, the physical part be that it be the hand to mouth motion type jump. You know, some people it's kind of they don't even realize that that's the problem. It's just a hand to mouth type of situation. Hence, they always smoking. Uh, I feel like too with the mindset. Um, a lot of people don't come. Well, I ain't gonna say a lot of people. Some people don't naturally come into drugs knowingly taking drugs. You know what I'm saying? Like you got some people that's quote unquote peer pressure, some people that they might have got slipped something, hence like a brownie, anything like that. You know what I'm saying? Jello shots, like anything that that little substance, it opened the door. You feel me to something else, or to keep chasing that little thrill or whatnot like that. I'ma just land right there.
Can I ask a question? How are we classifying drugs?
That's what I was gonna say.
Right.
Cigarettes, that's one thing. Codeine is another.
I
In
was
the
gonna
laws of
ask, what are we deeming a disease?
and
Great
like the law,
questions.
because they put out cigarettes and they kill motherfuckers, and you know how long it took for them to. They did everything in their power to stop weed, and they still be trying to stop it. And even in the place where it's legal, you got people that's like still locked up for like 20, 30 years over the shit that's legal now. It's just like, are we basing it on what is hurting us, or are we basing it on the stipulation of what is considered wrong from mankind?
That part, Z, because I like what you said with the cigarette, right? So, like, due to the physical habit forming, would that be a disease then if we're using it in the same sense of the habit forming of drug use, right? It's not a physical thing like we've came to the conclusion of. So, wouldn't that kind of take away from the disease factor of drug addiction?
No, that's why I used the cigarette for the mind frame because I that's why I brought up like the hand to mouth motion. You get what I'm saying? It's like
But see, would that be considered a
to
disease
me it
though?
would be considered a form of a disease. You feel what I'm saying? I, shit, you fucked me up with
You
that,
see
bro.
what I'm saying? That's my
I
point,
wouldn't
Floyd.
classify it as a
That's
disease.
my
Yeah,
point.
I technically
So
would
that's
probably.
why even see, and this is it's fucked up that I even have this perception, right? Because I have a grandmother who passed away from drug addiction, from heroin use, right? She fell asleep, nodded off, ended up on the wrong side of the road on the freeway, um, and was hit head on. You know what I'm saying? So it's a bittersweet thing with me. You know what I'm saying? Where I have somebody in my family who's been through this. Even my grandfather still battles with this to this day. Um, and I don't think it's a disease. Even though I've seen the bad of it, I think it's a choice, man. I really do believe that. And I do agree with the habit forming parts, but that still wouldn't be considered a disease to me. Like cancer is a disease. Habits are not a disease.
Now,
Precursor to the
I
see,
guess
disease.
that's a little bit tricky because if we look at things like mental illness, will we then say, like, let's say somebody has, I don't know, OCD, for example, can you say that's not a disease because a person can just stop whatever it is that's affecting them mentally? I think there can be
No,
physical ailments and mental ones as well.
I would say because see when you're talking about mental illness, that's something that has to do with a problem with the person's functioning brain. See, that's a physical element, which I would consider that a disease. Why? Because there's a physical organ that is not functioning properly, which gives the byproduct of what you're speaking to.
Right. And I think the same thing can be done or considered with drugs because, yeah, I guess somebody can start off, as Jordan said, choosing to take a drug, but then the next point is that this drug has affected the person mentally. And so now they actually have a mental illness, right? An ailment or a disease. That's how I look at it.
I'm gonna use an example. Cause y'all making good points that I like, and I'm gonna bring up something that like Miss Jordine had brought up as far as the physical part. Now, Mr. Vincent brought up, codeine, and I've been sober off codeine for 8 years now. You feel me? Like I used to drink 2 pints a day. You get what I'm saying? Damn near three. Uh, if you know how much that shit is, bro, that's damn near a lot. You feel what I'm saying? So, um, with that, the physical part, like to me the mind frame part of it was I quit cold turkey. Like I drunk my last cup, my wife came through, I was getting ready to have my baby. She was like, it's either your family or it's the cup. I literally quit cold turkey. The physical part of it though, bro, for me, and this where I noticed like with
It's a
codeine,
mother. It's a motherfucker.
it's a motherfucker, bro. This is why they say like code people who get off codeine literally have the same withdrawals as people with heroin.
Facts.
It's
Hey,
literally
that weed, that gas got the same effect too, bro. Take it from
not.
me.
I mean, to a certain extent. I'm just speaking on for me though. But like when I stopped bleeding, bro, like my withdrawals, I couldn't eat. You get what I'm saying? I was breaking out in sweats. I would be sleep. My wife would say like I would break out in shakes, bro. Like nigga was looking like Pookie off New Jack City, but I wasn't on crack or nothing like that.
Hmm.
You get what I'm saying?
But
Like
why is that though, Florida?
that's the physical part though. That's I had been
No, I
nigga.
hear
I was
you, but
tripping, bro.
I'm
I couldn't
saying
go to
like,
work,
why
That
is
nigga
it
ain't
that your
told
body
one lie.
does that? No, he's
That
bro.
nigga ain't
100%
told
correct.
one lie.
But what
I'm
is
gonna
it
say
that
it's the
made your body
physical
go through
because
that physical factor?
I'm gonna say because I had started drinking so much it became part of me. So when
No,
my
what
body
happened
was
was you
naturally,
had so much in your system that it stopped allowing your body to function properly, is what happened.
Well, your body became dependent on it in order to function. So your body would decided that, okay, this is going to be with us forever. Now we have to accommodate this thing being here now. So when it is now absent, your body now has to reconfigure itself to figure out how to be without it.
nah, that was I'm gonna be real though. That was the worst, like the
Right.
worst couple months of my fucking life, bro. I'm gonna be dead.
So to me, again, I wouldn't consider that a disease. I would consider that a habit.
Nah, I would say that was a physical thing, and I'm gonna say and see, I'm gonna use my shit going back to a disease part because it was all about like the hand to mouth for me, bro. Because like I I couldn't the type of work I did, I couldn't smoke. You feel what I'm saying? While I'm cooking people food. You feel me? So as the hand to mouth, I couldn't, you know what I'm saying, be you feel me, rolling up. But I could crack myself, I could pull up, I could keep me a picture on the line, bro, and I could still keep my hand in the mouth to occupy my time. Like that's literally outside of like smoking herb, bro. That's literally the whole reason I used to smoke tobacco, bro. Like, cause I was bored. You feel what I'm saying? Like it was never that, bro. I had to smoke cigarettes. Like, oh, I need to go through a pack. I need this nicotine, bro. It was literally about like, bro, I was
You
bored.
see what
Like,
I'm saying, Florida? You making my point. These are habits. That was not a disease.
yeah, hand to mouth, bro. Hand to
Hand to
mouth.
mouth. That's not a disease, bro.
Let me ask you this though:
It's a disease.
where does habit end and disease begin?
Great question.
When you no longer can function without it.
Because he wouldn't die if he just stopped using lean. Because
And
he's
some
still here
people
today.
do. Some people do. Some
And
people
why
Nah,
body
is
that's
that
shut
then?
that's the
down.
point I was
And
gonna
why
say.
is
And
that?
Like,
the way he was
Because
drinking it, like he was like Lil Wayne, Rockstar drinking it. Thank God his body didn't shut down when he stopped cold
that's a
turkey.
great point. Because they
That's a
chose to
fact.
do it, right? And their body, what happens is when they drink this lean, their body changes its chemical composition, as Jordan said. She just painted it in a different picture, whereas, oh, your body isn't going to function without it. No, it does. That's why
Mm.
we're still here. But what happens is when you have this in your body, it changes the function of how your body operates.
No, we get all that. We get all that. But this is what I think you missing. So this ain't the disease at Florida. Do you still have those cravings to this day, like they never left?
Hell yeah, I don't. I can't drink Sprites. I can't. It's certain like I don't drink lemonade,
Is
bro.
that not the
Like
disease, or that's
like
just the
any,
cravings?
bro. I'm gonna put it like this.
Oh
My
man,
wife about a
what are
month
you
ago, bro.
talking about?
My wife brought me a Dr Pepper on accident, right? You know what I'm saying? She thought it was a
Hmm.
Coke. They gave her Dr Pepper, bro. I took a sip of it, bro, and instantly, bro, I
You got
thought
the
I was
feeling.
fucking high. Like, bro,
You
I
felt the
literally felt,
feeling.
bro, like I thought she dropped something in my drink, bro. Like, no cap.
My mama, my mama popped codeine the entire time she was pregnant with me. So again, people who don't know me, I'm very transparent. I don't care. I tell my story. She popped pills when she was pregnant with me, codeine. Ironically, when I was 12, 13, I popped my first one. I instantly, it was like it was two marriages, two people meet for the first time in this first they first love, and it felt right. You know why? 'Cause I was born into this world with that shit, with that addiction. I was born in this world with that shit. So it was nothing for me to get on that shit and pop pills and do that shit. You know what I'm saying? What is that? That's not a that's not a disease.
Right,
No,
absolutely.
but now
I'm
addiction,
confused.
I'm with you on
Babies
that.
can be
I'm
born addicted
confused.
to drugs if the parents has been on drugs. Like that's like fetal syndrome. I don't know the technical terms, and they're actually addicted, and they have to get some type of medication to help the child. So you can be born with an addiction, right? And I wouldn't call that a habit because the baby's not had any experiences in life, so there's nothing that they've picked up to turn into a habit. It's an addiction basically.
That's all I'm saying.
I'm gonna
But
go a little
but you
further,
wouldn't die if you didn't have the drugs. That's the point.
but
It's not a
nah,
disease.
Flav, that's the
Now, if he
thing,
does the
brother. After
drugs,
a while, like, okay, bro, let's
I'm
say
confused. Please.
this why do you know why Fredo Santana? I'm gonna use him as a perfect example, bro. The man had been sipping lean for over a decade, my boy, like heavy, and he younger than Lil Wayne now. You get what I'm saying? So this nigga literally had been drinking lean since a teenager, bro. You feel me? Probably a little bit before he hit his teens, bro. Once he officially started to quit is when he died. Like he was actually sober when he died, bro. His body was so used to that shit, bro. You get what I'm saying? It's not like niggas who
Or
do Fetty Wap and all that. They giving
hmm
supplements. You know what I'm saying? That Suboxone shit, bro. It's no supplement I could take for codeine, bro, to help me wing off this shit, bro.
right, well,
You get
they
what
now
I'm saying?
they got shit called Suboxone and another one I can't remember the name that they give to people in the town that I'm at. And I think about what about that person that is addicted who needs some help that has this disease, but we don't look at it like that's just an addiction because they're addicted to codeine. And out here they got fentanyl pills and shit. Every time that person has that urge that they can't help, and they go out there and go get some shit off the streets, they playing Russian roulette when they buying this codeine shit. And listen, they take that fentanyl and they die. You know that I think that disease of that they body that need that urge that need to get it. That's the disease, and it may not it may not die just from not for having that disease, but that urge to make them want to go out there and get shit that's in the street and all this shit ain't legit is where they die. Is where the death I think you looking for. That's what's happening every day. These people going out, they had this urge. Nobody, we dismiss them and say that's just some shit. That's a habit. That we gonna dismiss that. Then they run out and go get some shit and they die. You know what I'm saying? And we don't care until it's somebody that we really know, and then somebody that's really clever, we really love. That's when we start to look at shit different. But that's what's going on every day. These people are addicted to this shit and they're going out there getting bad heroin, bad codeine with fentanyl in it, and they dying. No one wants to help them because we want to say that's a choice that they made and it's just a habit that they develop. Only until it happens on your front steps is when you look at the shit a little different. I'm gonna land right there. Welcome to the room. Who just came in? I can't say
I
your name.
actually agree to that sentiment, and I think you are right in a lot of sentiment. I just still am on the disease factor, like the habit. I think that is the issue in totality. I'm with you. Like you hit it on the head, but I'm just not with you on the disease factor, man. Like the addiction is the habit. That's the urge. That's the feeling. That's all of that.
Hey,
So I think
Slave, let me.
with
Can I give you one more story, bro? I'm gonna land with this. So I'm gonna just say the reason why my shit started. All right, I was in college. I got stabbed. I had to get I had to get surgery. Right, boom. My back surgery. I got 2 rods and 6 screws on my spine, bro. I had to relearn how to walk and shit. So through the hospital, I'm sitting on morphine shots. I don't know if you ever had a surgery. Anybody ever had to have a little morphine drip shot? But that shit is literally like pure heaven. You hit the button one time, bro, your ass is out of there. So I did that. I did that for a month. Boom, in the hospital for a month. They weaned me off that, bro. They gave me the codeine pills. They gave me oxycontin pills, the whole nine, bro. This is why you keep hearing me say hand to mouth. So for the next 3 months, I'm literally popping pills, hand to mouth, bro. Now I get off that, and keep in mind I'm doing the codeine pills, bro. At this time, the promethazine pills. I get off that, they give me a script for the lean.
Mm,
You
mm.
feel me? So
I
it's
tingled when he said that. Go ahead.
you get Vincent, you are whew, Jesus. You know what
I
I'm
don't
saying,
give a fuck.
bro?
I'm
Like,
me.
bro, my hands is literally sweating talking about this shit, bro.
Real
Like.
nigga shit.
Like, bro, so okay, boom. I did, nigga. I was getting scripts of lean for like 2 years, bro. Why? As I lost my basketball scholarship, all this shit, bro, because of my back. I'm recouping. You feel me? I literally ain't
Mm-hmm.
got shit to do, bro. You know what I'm saying? I'm literally
Mm-hmm.
at the point getting paid to basically be a junkie, bro. You feel
That
me?
part.
Mm-hmm.
So
Facts.
Of course, they
it's
was molding you, bro. I
Facts.
but
agree.
that's
But
the to me
I'm a
that's the disease, bro.
They was
I
I'm gonna
never
give
building
him
that habit up.
Can you put me
I
in the
went
queue?
3 years without technically being medically sober, bro. Medically
let,
doped up, bro.
That part, and
let
Low
me
that's the
key.
just get
crazy shit
let me get
about it. That's what I'm trying to say, bro. You making my point for me.
It ain't a
well no,
habit
let me
though,
give you this
bro. That
analogy.
technically ain't a
That's
Let me
habit.
give you
habit.
let me give you an analogy, maybe you'll understand. So me in Florida, our addiction, because we both aware we was addicted to codeine. So our addiction is like diabetes, right? And I have diabetes. That's how I know about diabetes. Well, it's like diabetes, right? Our addiction now, today. We don't do it anymore. It's like diabetes. We got the disease. As long as we stay away from sugars and sweet shit, keep our numbers right, we cool. The moment we go dibble and dabble in that shit we not supposed to, that's where the risk factor kicks in. See, this is a reverse disease than what you looking for. It's a reverse. It's that urge. You see when he said when he got to talk about that, I got the tingling, like I'm pouring that purple in my Sprite, shaking it up on my way to the club. Like you, that's what you gotta. That's the disease, bro. That urge, like goddamn, if I knew somebody that has some right now, I'd probably go get it. Just talking about it, my nigga. Just
But
nigga
see, this the
dreams,
difference
nigga
is
dreams
that you
about
would
it.
die if you didn't regulate your sugar. Some people's
When you
diabetes different. Some people need
Yes,
to eat some sugar. Some people don't need to
and
eat sugar,
I'm
and they
addicted
would
to
die.
codeine. I'm addicted to codeine, and I get prescription pills for my ailments, right? So I have to monitor how I take that shit. Well, okay, so let me get another though. When you go through your day, and Florida can relate to this shit. When you go through your day, you're thinking about millions and millions of different things, but you're not thinking about codeine or how you can get some money to go get some codeine, or who may have some codeine. You ain't even if you smoke weed like that, you know you what kind of weed you gonna get. You gonna get your weed, you gonna go about your day and handle your business. But a nigga who's addicted like that, all they think about is that. All they think about is that while they functioning through life. You know, you have those that can function and you have those that can't function. The ones that function are worse than the ones that can function. So I
That's
ain't
a
never been
fact.
to I ain't been to those meetings, but I know how they go because I was clever enough to get around that shit. Yeah, I know I should have had my ass kicked. See, this is just me being 100 with you. We can bullshit all day, but let's just keep it 100. The ones that's addicted that can function is way worse than the ones that can't, because you know what they're doing. The ones that doing it, they constantly trying to trick themselves into why they can continue to function and do this, and why that when they driving and they veer off, you was okay. It wasn't just the codeine. You was tired because you didn't get no sleep that night. No, nigga, it was because you on codeine, nigga. But it's that disease that got you thinking that way. See, you wouldn't understand it because you ain't in that position. You on the outside looking in. God
Hey, look,
forbid you ever
Vincent, what
get
if I
addicted.
told you I used to smoke cigarettes and I used to sip lean?
You used to do the same thing.
Yes, bro. That's what
Okay,
I'm speaking from
and
experience.
you
That's why I'm in
and,
this room. And my
I
grandmother
like your
passed
perspective.
away
Then let
from
me hear this.
heroin use, bro. She died nodding off and died in a head-on collision, my guy.
You don't think that was a
I'm trying to
disease that got her hooked?
No, bro. I think she had a poor choice and she fell victim
Okay.
to a habit. She never changed the habit.
Mm.
I want to speak
It
on
was
that.
not a disease.
Let the queen. I'm gonna let the queen go. You got it.
Hi, thank you for allowing me on the
Yes,
floor. Hi, Slave.
yes, ma'am.
I would say I'm in between both. I'm a nurse, so from my medical perspective, I would say that genetic factors do play a part in the disease part, meaning I do have I did have a friend who was an alcoholic and her father was an alcoholic, her whole father's side was an alcoholic. But when it comes to choice, this is where I say I think it has to do with your will. And there's a guy who just told a story about him having back surgery. Well, I have a chronic illness, autoimmune disorder, and it is very painful. And when I tell you guys right now, I literally can get probably any type of drug that I want, the strongest medication that I want, but I just choose not to because while in the hospital, and I was like really sick a couple years ago, they were pushing narcotics and things on me. But you guys, the narcotics wasn't helping, and I was just making the choice not to use it. Well, they had like a strong, basically acetaminophen, which is like a Tylenol, but it was like a higher level Tylenol. When they gave me that, you guys, I'm telling you, that was the only thing that touched my pain. They were giving me morphine, Dilaudid, anything that you can think of that's like a high dose narcotic. I had it, and it wasn't working. But whenever that lockout system happened, where they had to be like, "Hey, we can't give it to you right now, just because they have to monitor like your liver functions and all that stuff like that," they was like, "Well, don't you want the we got hydrocodone, you got morphine, you got Dilaudid, you got all this," but it was like I was telling them that doesn't work. It's not happening. So it was me making the choice not to take that medication because I knew one, I could get addicted on it. Two, it wasn't going to do anything for me, and still now to this day, like the medication that I have access to is just like I could be an addict right now if I want to, but I choose not to be because I know the road that I could go down very, very, very quickly if I chose to take these medications. So I think it's half will and then it's half addiction, because when I used to like drink a little bit here and there, I didn't think I had a drinking problem, which I didn't, but because I didn't drink a lot. But when me and my friends would go out, on the rare occasions that we did, I would binge drink to the point that I had no knowledge of what happened the previous night, which is a problem. But I didn't see it as a problem because if I was only going out maybe one weekend every 4 months or something, I'm like, that's not a problem, but that is a problem if you cannot remember. So, but alcoholism runs on my mother's side. And my mom was like, "You got an issue." And I'm like, "No, I don't." But when I look back on it now in my sober mind, that was an issue. That was a very big issue. So I think it has to do with, I think it's half will and half choice. Honestly, disease does play a factor, but you got to have, you know, a strong mind to say, hey, I know this runs in my family. Like we were talking about the diabetes. I probably can't eat like that. I probably can't drink like that, like the normal person, because what a little looks like for me can escalate very quickly because of my genetic make, that's different from everyone else's.
I definitely agree with that, Queen, and I think you're right. I just want to say though, certain things is easier to walk away than others. I drink liquor, but if I don't touch a drop of liquor in a year, I'll be okay. But there's certain things that's just a little tougher for people to just walk away from. But it do come down ultimately to will. So I definitely agree with what she just said.
Yeah, I 100% agree with that too. And I think that um that is one thing that helped me be able to just alleviate those things that were bad for me. Because again, Vincent, I wasn't even trying to just be biased, bro. I used to sip lean back when lean was plentiful and it was a couple dollars a line. And we was getting the full bottles with insurance. You know what I'm
Yes,
saying? So like
sir.
I remember them days. Like, you know what I'm saying? I was smoking Newport hundreds in the box, like for real, bro.
Yeah,
Was on that.
yeah.
And I just made a conscious decision like, look, I can't do this no more. I don't like how I feel. I don't like what it's doing for me. I didn't like nothing. I couldn't, when you start to really weigh them sides, like the good, the pros and the cons, and you like, all right, am I getting more
Right.
good or am I getting more bad? And I couldn't
Right.
find reasons to keep smoking cigarettes, bro. My breath was stinking. My breath tasted like cardboard. The stain in my teeth. It was making my stomach hurt, giving me headaches. It's like, bro, I'm not even benefiting from the motherfuckers
What's
no
the
more.
point?
The lean making me go to sleep. I'm selling bud, doing shit. I'm falling asleep, being loose as hell. Just I was moving like a fool, bro. I was being goofy. And I just wanted to stop all that shit, bro. I made the conscious decision and choice, like, you know what? Fuck these cigarettes. I threw them out the window, never picked them bitches back up again. Stop sipping lean. Never picked it up again. I'm around these things every day. But what Donisha said was so real. Will. That was so real because my willpower, I've never been a person in my entire life that's like, was like a peer pressure type of person. Like, I grew up on the west side of Detroit. A lot of shit went on, but I never dove into what they did, even though they would try to entice. You know how it is growing up in the city, bro. There's so many things that could peer pressure you into so many things. And bro, I just never been one of them type of dudes. I always came with my own little flavor, man. So and I will admit that. And that is everybody doesn't have that in them to just say fuck something and just walk away and never look back. So I can admit that.
I can I think Flav and Donnie, I think I just like we had a little epiphany is that I think it's where the mind I think it's all about consciousness. So the disease comes in where your mind and your physical have decided that this is necessary and that there's no check and balance with you. So at the point of disease is now, or at least when we're talking about drugs, is now somebody from outside has to come in because your consciousness, that check and balance that you normally would have is gone.
Hey,
Hey,
Caitlin brought up a good question. See, this is what was crazy about this, Caitlin. What you just asked. She says, what do y'all feel about the term functioning addict? That's what has me in this like weird position with this, Caitlin, because my grandmother was a functioning addict. Like she always had money. She never was broke. Never was a bum. Christmases had everybody mink furs, bought me my first car, like so many things that I can say she did. Like she was functioning, fully functioning. Had a husband. She got married a couple of times, but both her husbands both had money. Got left pensions from one of when both of them passed away. Just like all types of just never went without. I can, so it was one of the things like I guess your life is good, but it's just the way you're handling your family and your circumstances, and that I guess we have a problem with.
Well, I think
Uh,
that, sorry, D. I was just going to say something real quick. I think that it needs to be more awareness because when, honestly, learning about addiction growing up, I didn't really hear too much about a functioning addict. It wasn't until I got older and I started dealing with people with addiction that I realized, and as an example, my ex best friend, she's a functioning addict, like 120 pounds and can throw down, you know, a whole big bottle of liquor herself and she's driving, or not going to, knowing that you have to work your 3 days as a nurse, a neonatal nurse at that, and not drinking the night before, but and then not drinking on the days that you work, that you say, but then all the other days you're off, you're getting drunk, like to the point that you don't get up. So I think it's the fact that they think because they can control it, and they look at, that's where they make excuses for themselves, and that's where they don't think that they have addiction, is because they're like, well, if I could choose not to drink for 4 days or 3 days when I go to work, I don't have a problem. If I was an addict, I would probably think that I didn't have a problem, because when you think of an addict, a lot of people think it's a routine behavior that they're doing every day that they have absolutely no type of control over. So just if they can find control in any aspect of their life that they're controlling and not letting their addiction um, basically take over, then they don't think that they have addiction. So I think that part needs to be more brought to the surface and explained when we're talking about addiction, when we're educating anyone about addiction, because I didn't even, I was never told about a functioning addict.
Mm. See, where would that fall under it then? You see what I'm saying? Like, would that be the disease, or would that be just the choice of just, all right, I'm gonna disregard that this is you know causing me
Uh,
harm.
hold on, I'm gonna say whole time, Joe. It's a, it's a comfort. Now, if you like, I don't know, whoever who was talking said a bunch of words. Just how men think or whatever. Hey, look, check this out. Whatever you do, if you a junkie, you a fucking junkie. You need help. But if you a working mom and you like your wine and you like looking at prices right, that's your thing. But if your ass go to work and then at the end of the day, all you want to do is get a beer or two beers, happy hour, whatever, that's cool. If you can support your habit, you okay. It's not a fucking disease. It's just what you choose to do. Because some people get away in different ways. Like I like flying drones. I like doing that. I'm a driver. I don't like
Not
driving.
flying a drone.
Yeah, I fly drones. I like taking aerial pictures of the fucking the areas and shit. I like
Not
doing that
area
shit. Don't
pictures.
nobody else like that.
Yeah,
My mom like planting flowers. I can
that
give
one
a
got a
fuck
little
about it.
shady.
I stomp on a
Not
fucking
paying
flower.
fly. What's up, D?
Yeah,
I'm
Hey B,
fucking
don't
with you.
don't do that
Okay,
shit too
D.
early. Don't do
Okay.
that shit too early, bro.
D,
No,
can
it's
I ask you a
certain people in
question?
it. Some people are into certain shit, and that's what drives their the chemistry in their head to actually do something. Like some people like fucking a lot of girls. Some people don't. Some people can't fuck girls. But you can't call it a disease. It's your choice. I don't like covers at night. She do, but is that a disease? No. I like high quality technology. Do I want a Samsung watch? Fuck no. I want an Apple. Is
Not the
that a
Samsung
disease?
watch. What the
But is that a disease?
what the Samsung do to you?
I don't play video games. But is something wrong with me? No.
Not
It's
Xbox,
just my choice.
PlayStation.
I don't even know the difference.
But the thing, but D, the
But
things
there
that,
is a prop.
but
There is. Go ahead.
But D, the things that you're talking about, liking your foot out from underneath the blanket, or not liking
Mm-hmm.
covers, or liking covers, or liking video games, or not liking video games,
Mm-hmm.
those don't correlate the same as an addiction to, say, drugs or alcohol or caffeine or tobacco.
I'm gonna tell you you're
Those,
wrong. You're wrong.
hold on, D, let me finish. I let you finish. Those don't correlate the same because those things don't mess with your mental. And chances are that somebody who struggles with addiction struggles with something mentally that has caused them to choose to become an addict. Now, they
Facts.
made the choice to use, which in turn led them down the road of addiction. So, the things that you're saying and the things that you're using as a comparison, they don't even equate the same. Addiction is much different and on a much higher level than what you're talking about.
Okay, ma'am. All right. I said ma'am. Notice I said that.
You don't
All
have
right.
to, it's okay.
Look, okay, addiction to something is a addiction. Now, it's people that done died playing video games, right? It's people that died from jogging because they're addicted to that subject. Now, I'm not downing you what you said. What you said was fact. But it's people who are addicted to cigarettes. It's people who are addicted to weed. But then it's people that are addicted to happiness, and it's people who are addicted to fun. And you always think they're weird or whatever. Like if I see somebody that's always fucking happy, kind of pisses me off. Am I addicted to a person that's happy, or I'm pissed off at that motherfucker because I have an addiction to be hatred or racism? You can throw that in there. Is that an addiction too? I'm asking a question. That's all.
That's an internal issue that needs probably to be. And I'm not speaking on you directly, so don't think that. But a person that has a problem with a person being happy, that's an internal issue that needs to be addressed within themselves. And if they need to seek professional help, that's what they need to do. That's not really something you can compare to an addiction like something like really like that's the thing about addiction is where people try to justify it and compare it to something else. You can't really compare certain things because like you said, yeah, sitting in the room, you're playing video games. Everybody knows now if you pay attention and if you read, yeah, increased amount of screen time, sitting in the dark playing video games, you playing, yeah, you're likely to want to go shoot some shit up. Yeah, you can, because anything, sitting in the dark, not even exposing yourself to sunlight, you're going to, is linked to depression. So you can't really compare wanting to go jog because jogging, yeah, you can overdo anything, but you're going to have better health if you're jogging. You're most likely probably not overeating. You're getting outside, so you're exercising. You're actually prolonging your life versus you said it sitting down saying, I'm about to drink all day. Because sitting around drinking all day is something wrong. If you're drinking all day, it's not saying, oh, I just want to go out. I want to drink because I like it. No, a lot of people like to have a drink. There's no problem having a drink. It's when your money is going primarily to drinking. It is when you're saying,
Okay, I get
that's what I'm saying.
you. Okay, I understand. Well, they just pieces of shit. Can we just classify that?
No, they're not pieces of shit
No.
either.
No, I don't think that we can. I don't think that classifying
Wait.
somebody who struggles with an addiction is a piece of shit.
Yeah, no, that's not right
No, I'm
at
talking about
all.
the drink part. The drink part. I ain't talking about like if you on cocaine or something. I'm just
But
saying if you
anybody who
drink.
has
It's
an
the same
addiction,
thing.
but anybody
Okay,
who
all
has
right.
an
I'm sorry.
addiction, they're not pieces of shit. They're human beings who are struggling with something internally, mentally, that is preventing them from making the change to get where they need to be. Somebody who struggles with addiction, I'm telling you
Mhm.
right now, I work in addiction. I work in substance use addiction every single day, 5 days a week. I see it every day. These people struggle with something mentally that
Yeah.
until they get the mental help that they need and until they identify the underlying cause of what turned them into addiction and what pains it was that they were trying to hide in using whatever their choice of drug was, until they internally can identify that and take care of that mental health issue, the addiction doesn't always
Mhm.
go away, and they are not pieces of shit.
You going in the matrix, man? You going in the matrix?
I don't know why I'm in the matrix. Am I still
I
No,
can
you
hear
still
you
going.
okay, Crystal.
We can hear you. We can hear you.
okay? um I don't know where I left off, but I'm just gonna land it with this. I work in addiction every single day. I see people every single day that are struggling with addiction on opioids. I see what it does to the people. I also see what help these people need. And 9 times out of 10, what I've seen with the patients that I see every day is they have something internally that mentally has fucked with them to where they felt that they needed to use a substance in order to hide the pain because the substance is what made them feel good, it made them forget about the pain that they were feeling and made them forget about everything that was hurting them. So until that gets fixed, the addiction doesn't go away. But these people are not pieces of shit. These people are human beings who are struggling with an addiction. And I'm going to land my plane right there.
And
Hold on, I'm gonna
D,
take that back. I'm gonna take that back. I ain't mean it. I was just saying in general. But no, I'm
Could
saying
could the
I apologize. I
could the other
apologize.
queen
another,
couldn't the other queen speak? Go ahead.
oh yeah, go ahead.
No, you. I
Oh,
was just
okay. Sorry. I was gonna say another like quick little story I'll share about myself. I always had said I'm 29, and in 2018, my brother and his daughter they were murdered. And I swore to myself my whole life, I was like, I ain't never gonna smoke in my life. But I tell you, I think it was 6 months after that I was struggling so bad. Like I wasn't grieving the correct way. Like I was in therapy, everything, but I was struggling so hard. I was like, I'm about to start smoking weed, and I did, and I still don't regret it. But it was just like I was only smoking really not because I wanted to smoke, not because I was feeling pressure to smoke, or just because it's just becoming more glamorized. It was because I was just at my last, like, man, I don't know what to do. I just needed something to basically suppress my emotions and let me just forget about what was going on. And I started smoking. And now I just was like, you know what? I'm not gonna do it anymore, and I stopped. A couple months ago, I was just like, you know what? I don't want to do this anymore. Like, and I don't see. And if I decide I want to do it, that's fine. But the only reason, and I can be honest with myself, The only reason I did it is because I was trying to get away from my emotions because I didn't know how to deal with my emotions.
Fact. It's on you, D.
Hold on, my
Oh,
bad.
welcome to the room,
No,
Zoe.
I just wanted to just say I apologize on that part. I just said piece of shit
You said I
because
was a piece of shit.
this nigga. Yeah, no, I said in general, I was like, they're a piece of shit. But no, I understand. I'm listening. But like I say, like, all right, for instance, it's this dude named, his name Larry, whatever. This man always be in front of the liquor store, right? And I get that man money every day. And I don't know what's going on in his life. She made me think different. It probably something going on in his life. But at the end of the day, I always get that dude money. And then for some reason, he never remembers that I gave him money. So I did some bullshit and I told him, hey, if I see you again, we going to have a problem. So I never seen Larry no more. And now I miss seeing Larry. So it's fucked up. Larry ended up getting hit by a car. You know what I'm saying? And if I think I was a part of that problem because I actually could have went to him and told him exactly like, hey man, what's going on in your life where you came to the bottom to this? You know what I'm saying? You ain't got no car. You ain't even got a fucking bike. You ain't got shit going on for you, Larry. But I'm saying it's got to be some. All right, if it's mental, where's the struggle and where's the hustle? That mean you weak minded. Am I still on here? I got you.
Hey,
Okay,
no, it listen, hey, bro. It don't mean you
go
weak
ahead.
minded, bro. It do not mean you weak minded, bro. Cause I had
Okay,
an addiction, my nigga, and was working 3 jobs and in the fucking trap, bro. That don't mean shit, bro. And I was
okay.
taking care of my family, bro. Niggas catch addiction, bro, cause it be life shit, bro. Like my addiction simply came from, bro. Had I not went to like, bro, I think about that shit all the time, bro. Had I not chased the NBA dream, bro, and went to college, bro, I wouldn't have got hurt. Had I not got hurt and stabbed, bro, and had to get back surgery, bro, I would have
Mhm.
never even been hit with medical drugs, bro. They would
Hold,
have never even had to prescribe me, promethazine, bro. Like, don't do
hey
that, bro.
fan, hey fan,
Don't
hold on,
do
hold
that,
on. No, no, nigga, I corrected everything I said. But how old are you right now?
bro. I'm 32,
All right, so you decent. Nah, Larry was motherfucking 50. I'll give him 60 at best. But I'm saying your whole life you've been doing this same
bro.
thing.
You don't know what that man went his whole life,
When
though,
can you
bro.
bust out of that?
Bro, you don't
But
know what
when
that
can you
man went.
bust out of it?
D, D, you don't know
Go
what that
ahead, bro.
man went through, bro. You feel like,
Or currently
Not
going
every
through it.
especially at
man.
that
Listen,
age,
man. Listen,
bro.
listen,
When you
bro.
talk
What he's
about
trying to
I'm gonna
tell
be
you
quiet. I'm
is,
gonna be
bro, you
quiet.
can't.
when
Nah,
you
nah.
talk about
You should talk,
elders,
bro.
bro, when you talking about the elders, bro, I like that's what I learned as a youngin, bro. Like I never judged elders, bro, because like,
Exactly, I did.
but listen, bro, but you did, bro, because you just said, bro, for his age, why he whoop de whoop, bro. We don't know what that man went through, bro. You get what I'm saying?
But
Like
how
the
long
time.
is
Hold
that
up,
gonna
Let
take?
him
hold
land.
up.
Let him land.
All right, I got
The
Yeah,
time
bro.
frame, bro. The time frame. You gotta think that man, and I'm just using him because you saying the age, bro. He, bro, you don't know if that man went to the army. You don't know if that man was in the service, bro. You do know a lot of the old heads linkage would link to them going to Nam and shit, right? Them going overseas, bro, right? You know, a lot of soldiers, bro, they face alcoholism, bro. They become alcoholics in the service, bro, because they can't do no drugs or nothing, or they do pills, bro. And that end up being, they'll get addicted to medicine, bro, because shit, in order for certain people to get their disability and their benefits, bro, to try to get out the service, sometimes they got to go through medical. But that's a whole nother topic. For two, bro, okay, let's say he did go through the service, bro. You gonna say, damn, why he didn't get help with the VA, bro? You do know the VA really don't be helping people, right? especially
And
when
you got to take the medicine to even get through the
bomb,
whole VA program. My pops was
bomb,
military, so I'm with you.
bomb.
But that's my saying, bro. It's choices.
Hold up. But how is that, nigga? How is that a choice though, Flooded,
Cause these niggas
bro?
don't want to do
If
that,
we in
Florida.
the
They do it because
military,
they got to, bro. My pops got pension from the military. The only way he could is going through the VA. And what do you have to
it,
do? Go to doctor's visits. And what do they do? Take your blood.
so how was?
And what do they
But that's
do?
what I'm
See if
saying,
you
bro.
actually
That's not
taking
a
the
choice, bro.
medication. And if you're
That's
not
not a
taking the
choice.
medication, you don't get your benefits. You see
That's
what
not.
I'm
But
saying?
listen, that's not a choice because, well, in a sense, it is a choice,
It
bro. But
is.
it's not a choice in a sense, bro, because they only going through the medicine, bro. And correct me if I'm right or wrong. To get the go for 100% disability, correct?
Yes.
Because they getting offered something, bro.
Yes.
They getting offered something, bro. So they only doing this shit, bro. So you could say that's a choice, bro. But technically, bro, I look at it, it's not a choice, bro, because, bro, if I put my life on the line behind this, I took this oath, bro, and you gonna hang
Facts.
over my head, bro. Why should I have to go and do that? That's why I feel
Yeah.
like it's not a choice, my nigga, because they
Yeah.
not looking, they doing what technically, bro, they trying to get what's rightfully theirs, bro. So it's not a choice. To you looking at it as a choice,
Facts.
bro. I'm
No,
looking
I
at it
give you that.
technically as they
I
being
agree with
forced.
that because it's like the red and the blue pill. Like I'm still choosing between the two choices you gave me. So I mean, I'm with you in that aspect.
I think both of y'all right though.
It's a
Real,
vicious
real.
game.
Y'all both
Yeah.
right though. Y'all both right though.
Both
I
right.
think Zoe, you want to chime in? I see you in the chats.
Yeah, I had to drop off some knowledge in the chat. But mental, clearing out the clutter of your mind, right? We can't have too much heavy stuff going on. Like a box is in the attic, you just clear it out to start.
Unfortunately, like nobody is exempt from the trials and tribulations of life. And life is hard, and nobody has the answer. Nobody actually has the blueprint. Nobody knows what's going on, what's next, how to work through this. Nobody knows. So everybody different. And what you may feel like you can get through, another person like I can't do it. And we all have coping mechanisms to get through life. And unfortunately, some coping mechanisms are more detrimental than others. But we all have it.
Right. I would agree with that.
Like some people are sex addicts, some people are weed addicts or whatever, but all you got to do is stop. And I know y'all gonna attack me over that, but some people like
We
kids and
ain't gonna
shit or
attack
some
you, bro.
weird shit. Some yeah, but everything is
That's a
weird to
fact.
another person. You know what I'm saying? Some people like old chicks. Some females like old dudes. Some people like women. And some, you know, no, I'm saying some females like women. It's just something that's programmed in. And there's nothing you can do about it but just try to understand it.
Bro,
And
Is it programmed or is it natural for them to like what they
it's
like?
probably, to me, I think it's probably both. Yeah, yeah, there we go. Because, yeah, I was looking at Disney and I had to turn that shit off because that shit got a little weird. The hell's going on here? Mm-mm.
So I just want to jump in real quick and say to Dee, you don't have to apologize for your feelings on this because everybody has their own feelings and their
Nah,
own opinions on
but
addiction.
I was
D,
on some
D,
comedic shit.
D,
I was on some
D,
comedic. Yeah, go
D.
ahead, brother.
Bro, I know you the cutoff king, my boy, but goddamn, bro, you gotta let people land, my boy.
No,
Shit,
yeah, I was just trying to
wasn't
say that.
done
No,
though,
I was
nigga.
just on some
She
comedic
wasn't
shit.
done.
Okay, man, I'll let her land, Joe. I'm sorry,
Right.
bro.
But what I'm saying is you don't have to apologize for that because you are entitled to your feelings and your thoughts and your opinions just like everybody else is. But what I will say is, in my opinion, addiction has a stigma on it, just like mental health does. And people look at somebody who struggle with addiction and they look at them in the view like what you had said earlier, that they're just pieces of shit. Or people look at somebody with mental health and they say they're using that as an excuse. There's a stigma on addiction and a stigma on mental health. And until we as people and humans can acknowledge that there are underlying reasons and that these people are actually human beings who just need help, then this kind of thing is going to continue going on. It's always going to be there.
Nah, that's a fact. I'm gonna add before you go in, D. Cause bro, I struggle with my addiction still every fucking day, bro. Like, I nigga, if I go to the gas station, bro, I still double cup my drinks. You get what I'm saying? I still make certain drinks, you feel me, just to make it purple, bro. Like, it be like little simple shit, bro, that like my wife don't pay attention to, but bro, it be like, damn, that shit still reminding me of that shit. You know what I'm saying? Coffee cups, bro. I won't drink a coffee cup unless it's double cup. You get what I'm saying? Um, I only drink like if I go instead of sodas now, I only drink like fruit juices, but it gotta be like a certain flavor. It gotta be. I gotta mix it and make it a certain